This kid was in handcuffs for 6 hours that night because we did not have the staff to handle it, nor did we have a restraint bed.
Claims of patient neglect, safety issues, and leadership problems at a local hospital. It's a special On Your Side investigation you'll see only on KY3.
From not being bathed to putting suicidal patients in rooms with sharp objects. That's what former workers say happens at a psychiatric hospital on Springfield's north side. Ashley Reynolds spent months investigating, and now the state is too.
Chances are you know this place, I-44 and National. Thousands drive by Perimeter's Springfield Behavioral Hospital each day. Very few have been inside, but Kelly Collins has.
If it were my son or my husband, there's no way I would put a family member there. No way.
Collins was a nurse there this summer.
A lot of them don't know where they're at. They don't know who they are. They hear voices. They are fearful that people are trying to hurt them.
There were a lot of elderly patients that weren't getting bathed or bathed properly.
This kid was in handcuffs for 6 hours that night because we did not have the staff to handle it, nor did we have a restraint bed.
Melissa Bush and Liz Miller worked there too around the same time, both nurses. They say this building is not structured to house these patients.
They have individual air conditioning units. Most of our patients are on suicide watch. They have sharp edges on them. They could cut themselves. I'm surprised nobody figured that out just yet. I'm sure they will. They have shower curtains instead of having the doors that close on the showers.
This week, a nurse snapped these photos for On Your Side and says the situation is not better. We asked the hospital and were sent to a corporate communications person in Georgia. She said the shower curtains meet safety codes. Nurses on the inside tell us patients have attempted suicide with curtains. My AC unit question was not answered. After these nurses left, in mid-September, workers with the Centers for Medicare and Medicaid Services made an unannounced visit. About a month later, On Your Side obtained a copy of the report filled with deficiencies. The report finds the hospital is not in compliance, and failures had the potential to affect the quality of care and safety of all patients. Government workers plan to cut funding by the end of the year if problems are not fixed.
We had falls that should not have occurred if we had somebody watching.
Nurses say management cut staff to the state's minimum levels.
This kid's like 6'4", 180 pounds, solid muscle. He blacked the eye of a tech, female. He punched another tech. He punched a security guard and bit him. While that was going on, that incident triggered another kid on the unit who started he had a meltdown. And then he started slamming his head on the floor.
Often we had to isolate them in the room for a short period of time with the nurse in there to help calm them down. And that took the only nurse on the floor away, for 30 to 45 minutes at a time.
While someone is restrained, a staff member shall maintain continuous face-to-face observation. Inspectors found that did not always happen. The report goes on to say it could cause undue stress and/or harm to the patient.
I had texted my boss that if I was going to be expected to do 5 people's jobs again, to please take me off the schedule permanently because it was unsafe.
To get answers, we went straight to the top. This is Rick Hardy. He was hired as CEO this spring.
We prepared and knew there would be struggles as a new business, but when Rick came in, I feel like things just got way worse.
Harding used to run Clearview Behavioral Health near Denver.
Tonight, a major change in leadership at a Northern Colorado mental health facility.
Denver 7 has confirmed CEO Rick Harding is no longer in the top spot at Clearview. Dozens of patients, family members, along with current and former employees questioning the facility's quality of care. He worked as a mental health technician, paid just above minimum wage. Out of frustration, he quit after a year.
I've had a few times where it was me and 18 psychotic patients.
Was that safe?
When I don't have 4 eyes looking around everything around me, it's not safe at all.
Earlier this year, our ABC affiliate in Denver spent months investigating Harding. He resigned, then Perimeter hired him.
Maybe they didn't Google him. I don't know.
Here at Perimeter, government workers found a list of problems under Harding's watch. Failure to conduct abuse investigations, not informing patients of their rights, and staff not completing first aid training.
This is all happening all over again.
After the inspection, Harding wrote up this 50-page plan of correction to CMS. Harding responded to every problem and how SBH will fix it. Harding started with reviewing his own job description. Staff will monitor patients in restraint. He'll start an abuse prevention program. All staff will be trained on patient rights. Shortly after the state accepted Harding's plan, he was replaced. Using Greene County property records, I found his home.
Hi, I'm Ashley Reynolds with KY3. Hi, bud. How are you?
Good, you?
Are you Rick?
Yeah, thanks.
Hi. I'm doing a story about what happened. Would you like to say anything about your time at Springfield Behavioral Health?
I'm good, thanks.
Will you talk to us about what happened in Denver?
No, thanks.
I asked about Harding. Perimeter's corporate communications person tells me employee matters are private and confidential.
Things seemed to be more about the monetary gain than protecting our patients and staff.
These 3 nurses say they won't work for SBH again, but hope the patients inside these walls will get better care.
Especially if they're mentally handicapped or they're, mentally ill. You have to be even more of an advocate for them.
We did ask Perimeter for an on-camera interview. That communications person refused, saying she couldn't swing it and it wasn't in the best interest of the patients and hospital. She added Medicare is not being terminated. However, state workers tell me they'll revisit the hospital and determine its fate. For On Your Side, I'm Ashley Reynolds.